This morning, Ask It Early is back. Our own Dr. Jennifer Ashton here to answer some medical questions that you have posed. Good morning, Doctor.
Good morning, Maggie.
Before we get to that, did you all see the front page of the New York Times this morning? I'd like to ask you about this, if I may, because I don't understand why the American Cancer Society, I mean, when you read the article, you get an idea, but please explain why they're saying now that detecting cancers, going in for screenings, is not necessarily the right thing.
Right now, complicated issue, and we want to be clear to people that we don't want people to delay or avoid screening for a variety of cancers. Screening is very important and has been shown to save lives. The impetus behind this article, though, Maggie, really came out of the fact that in the cancer community, there's been a little frustration about the fact that with certain types of cancers, screening and early detection has not been shown to have quite the impact in terms of catching late-stage cancers or saving lives as we had hoped. Really, they're talking here about breast and prostate cancer, and people, bottom line, should talk to their doctors and not just skip screening altogether.
Definitely. Thank you. All right, let's get to our viewer questions. Ask It Early time. We have Craig standing by on Skype to ask a question from Charlotte, North Carolina. Good morning, Craig.
Good morning.
Go ahead, doctor's listening.
Hi, Dr. Ashton. I just wanted to ask, we have a 13-year-old daughter, and she has gotten swine flu from, we think, classmates who've been coughing. And I just had a concern about the cough, how long it's contagious, and how long this cough is going to last.
That's such a good question, Craig. And, you know, we kind of went through this when Harry was sick because a lot of doctors are not actually doing confirmatory testing for H1N1 anymore. But in this swine 09 season that we're in, the logistical question that you brought up is a really important one. When do you let your child go back to school if there's cases in their class? When did Harry come back to work? And it's a little, again, controversial. We know that children can shed the virus for as long as 7 to 10 days. But the CDC didn't want to say to people, you have to keep your children home for a week or 2 weeks, because that would just not be logistically feasible. So we say 24 hours after a fever is gone. But again, if you're concerned, err on the side of caution. We let Harry come back after about 2 days of no fever.
But if somebody, a day too early.
But if somebody who has swine flu, like he said, is coughing around you, is that?
Well, again, that's where it comes to our hygienic practices, right? I mean, Russ and I always joke about it, cough into your elbow. If your child has classmates that you know have had H1N1 and they're still coughing and sneezing, they probably really should not be in school. And if they are, as a parent, I don't think there's anything wrong with keeping your child home.
And the other reminder on that is the study said, and it really gets transmitted by hands.
That's
it's
right.
not this way, it's this way.
It's both, but
exactly.
H1N1 is actually more on your hands.
So walk around with the Santa wipes.
That's
what
right.
I would.
That's right.
So I got a text from my friend Sylvia Yanis, and she said, are you going to give Daniela the swine flu vaccine? I am leaning towards it finally because of everything that I've heard, but if you were asked that question, what would you say?
We are giving our children the vaccine. In fact, I am happy to say that they arrived in my office last night. Wow. I took the H1N1 vaccine myself at the end of the day yesterday, and I'll be giving it to my children in a couple of weeks because they just got their seasonal flu shots in the last week. There are no firm guidelines about how to space that out for children yet. We're probably going to hear something from the CDC soon. It might be 2 to 4 weeks.
You're recommending the mist, though, correct?
Unless you have asthma or an underlying medical condition, yes, I'll be giving my children the mist. I think that's a good way to go.
That is the number one question I am asked on the street when it comes to people bringing up Dr. Ashton is, should I get my kids vaccinated?
And you know what I think we say in medicine, Dave, and I know Harry and I have had this conversation many times. In medicine, there's a saying, it only has to happen once. If it happens to your child...
Then you'll regret not doing it.
Exactly. And I think that the risks of this virus really far surpass the risks, even though they're low, of the vaccine.
And we should mention what we talked about at the very top of the show. It seems as if this is a disease really targeting the young.
Yes. That's right. Absolutely. So I think that most parents really should talk to their pediatricians and
So we should do this Twitter question,
We're going to go, I think, to Skype again because we don't want to run out of time. And Susan is standing by live in Westchester County, New York. Susan, go ahead. Ask Dr. Ashton.
Hi, Dr. Ashton. My husband has allergies all year round, and regular antihistamines don't seem to be helping much. So I'm wondering, are there any holistic or natural remedies that he could use that might get a better result?
Great question, Susan. Two important things. The gold standard for treating really seasonal allergies are not antihistamines. They're a medication called Singulair, which stops the symptoms before they start rather than antihistamines, which are just putting a Band-Aid on the symptoms. So they should ask about Singulair. The other thing is holistic things like honey, vitamin C, even removing those drapes behind you might really help his allergy symptoms.
Good luck with that, Susan.
Thank you, Doctor. If you have questions you'd like to ask, just go to our website, earlyshow.cbsnews.com.